All right, guys, Medicare Minute Time. Got a great question about long-term care, how Medicare or an MA would pay for that, what the differences are about short-term care, long-term care, assisted living. I think this is an excellent question because it causes panic amongst agents and members overwhelmingly. Let's dive right into it and let's get it done. All right, let's start on a high level and then we will come down from there. So, starting at the top, Medicare does not cover long term custodial care. What that means is Medicare doesn't just pay for someone because they want to live in a facility and they might need daily help with activities like bathing, eating, getting dressed, or supervision, right? So, if you've got a member or if you know someone who's in a nursing home as a permanent resident, almost always these members are paying either privately, we're talking 6 to 12 grand a month, they are in Medicaid spend down and the state's paying for them, or they have some type of long-term care insurance that's footing the bill. And that's true whether we're talking about original Medicare, Medigap, or a Medicare Advantage plan. So across the spectrum, almost exclusively either Medicaid private pay or some type of long-term care insurance that they took out before they were put into a skilled nursing care facility or a nursing home, right? Medicare has never paid for long-term care coverage, and a lot of people get mixed up because Medicare will pay for skilled nursing care, but only in the right situation. So think of it like this. Medicare is going to pay while your member is in the nursing home for rehab, but not their residency. So an example or a scenario may be your member goes to the hospital, they stay in there for 3 days, they get transferred into a skilled nursing care facility, they need rehab, whether it's physical therapy, occupational therapy, some type of skilled nursing care, right? And Medicare can help pay for that short-term skilled stay. In fact, Medicare can cover up to the first 100 days. That's really the limit to it. And after day 100, your board, your room, to be dressed, to be fed, that's on you rather than Medicare. Medicare will still pay for medically necessary care while you are living there, being sponsored to be there. So when we're talking about things like doctor's visits, specialist visits, blood work or lab work, outpatient procedures, so any kind of outpatient surgery even that you might need, Part D prescriptions, durable medical equipment, ambulance rides, maybe x-rays, MRIs, CAT scans, some type of imaging, wound care orders, diabetic supplies, durable medical equipment. These things can still be covered depending on your coverage. So if you run into a facility that says, hey, we don't take your plan or Medicare doesn't pay here, that's not exactly 100% true. While Medicare is not going to cover, or your MA shouldn't cover, unless it's some unique situation, room and board and for someone to bathe you and feed you, Medicare is still paying for medically necessary things. What the facility is probably referring to is your bed rate or the facility's contract, or maybe the facility's pharmacy isn't covered, or there's an in-house physician group that your MA doesn't have in network, or maybe a vendor they use for therapy, or a home health agency, or a preferred lab that your Medicare Advantage plan doesn't cover. That doesn't automatically mean that you have no coverage while you stay in their facility. So let's look at how a Medicare Advantage plan specifically might work with long-term care, right? So someone who's in a nursing home for a long time. Facilities usually use language like network, even if they're not being precise. So it would be a good thing to do your homework for your client. You know, a nursing home could be in network for medical services, as in the physician group that they outsource, but still not contracted for certain parts of care. Or it could be the reverse. They're not in network for the physicians, but they are for some vendor they have for durable medical equipment. So what a facility basically would be saying at that point, if they choose not to be a network, is that they don't want to deal with that plan's pre-authorization restrictions or requirements. Maybe they don't like the way they do billing rolls or their discharge planning. And that happens. That's a part of, it's a part of the role when you take a Medicare Advantage plan that you should understand. Remember, MA plans still have to cover everything that traditional Medicare covers, but they can have different rules and networks. They can't just come out and decide, though, we do not cover skilled nursing. So probably the easiest way to explain it to a member would be to say something like this. if you ever have to come into a long-term care facility and you have original Medicare with a Medigap, you're not buying a networked product. The providers should be able to cleanly deal with Medicare when they're billing, and the Medigap should pick up Medicare's cost sharing for your first 100 days. On an MA, you've got networks and prior authorization rules that can matter depending on the facility. A facility may be out of network, so you can't necessarily go exactly where you want to. And a plan may require certain processes. And if skilled care is required, PAs and documentation matters. Either way, though, neither of these are going to pay for long-term care living. Traditional Medicare won't do it. Medicare Advantage won't do it. So let's say you've got a client, who's 82. This member lives in a nursing home. We'll say they're stable, they don't have a new hospital stay, and there's no skilled rehab needs. So they need no occupational, speech, or physical therapy. And they're probably paying somewhere $6,000 to $12,000 out of pocket every month, depending on the city, because of how expensive that is. And that is not a Medicare covered expense. However, your member still needs blood pressure management, right? They might still need diabetic medications or cardiologist follow-up or labs or prescriptions or maybe durable medical equipment like oxygen or some type of imaging, x-ray, CT scans. Those are medical expenses. They're not covered in your rent. And since they're medical expenses, traditional Medicare and your Medigap and Part D will pay for them, as well as on the other end of the spectrum, Medicare Advantage plans are contracted to pay for these things. So what really matters then is not does Medicare pay for the facility, because after day 100, you're talking about long-term care insurance that's going to pay. The question is, does Medicare pay for my members' medical care while they are here? And if you're on the phone with someone, as you're running this a lot, that's power of attorney over a loved one, and they're panicking, I'll give you a good line that I would use. Mr. So-and-so, Medicare doesn't usually cover long-term nursing home living, but it absolutely still can cover your mom, dad, grandparents' medical care and prescriptions while they're there. So let's break down exactly what a facility wants and what they're looking for, and we can talk about what is your out-of-pocket or your loved one's responsibility, and what Medicare or your Medicare Advantage plan is going to come in and cover for them. So let me just tie it all together with this, right? Here's your answer. Medicare does not pay for long-term nursing care living. However, Medicare does still cover medical cost while someone's living in a facility. And it's why it's such a great cross-sell, or at least something all agents should talk about. This should be a fiduciary thing, in my opinion. They should all bring up long-term care insurance, because if long-term care insurance, if a member ends up full-time in a nursing facility, unfortunately, you could be looking at, and this is right now, $6,000 to $12,000 a month. Who knows what half a decade, 20 years from now, what that price is going to look like. And for a lot of people, it ends up bankrupting them into Medicaid.